Welcome to Med Insights. My name is Dr. Ade Jatin. In this video, we will talk about the white blood cell component of a complete blood count. Let's go. A complete blood count is a fundamental diagnostic tool, and the white blood cell differential is a critical component. It provides a quantitative and proportional breakdown of the 5 main types of white blood cells in the circulating blood. These cells are the pillars of the immune system. The differential count is essential for diagnosing infections, inflammatory diseases, and hematological disorders. White blood cells are the body's immune cells responsible for fighting infections, responding to inflammation, and maintaining immune function. In clinical practice, the analysis of the total white blood cell count should always be done in conjunction with the differential count of the cell types. The specific reduction or elevation in the cell type counts provides important clues to identify the underlying cause. The differential is typically reported as both a percentage of the total white blood cell count and an absolute number. Clinical decisions should always be based on the absolute count, as the percentage can be misleading if the total white blood cell count is significantly high or low. The 5 cell types are neutrophils, lymphocytes, monocytes, eosinophils, and basophils. The first on the list is neutrophils. They are the body's first and most numerous responders to acute inflammation. They migrate to the site of infection, engulf and destroy microbes using enzymes and reactive oxygen species. Neutrophilia, that is high neutrophil count, may indicate acute bacterial infections like pneumonia, acute appendicitis, pyelonephritis, amongst others. Sterile inflammation as a result of tissue damage from burns, trauma, surgery, amongst others. Stress and corticosteroids, myeloproliferative neoplasms like chronic myeloid leukemia, and smoking. Neutropenia, that is low neutrophil count, may suggest overwhelming infection from bacteria or virus, bone marrow suppression due to chemotherapy, radiation, aplastic anemia, or infiltration by cancers, vitamin deficiencies, autoimmune destruction from conditions like systemic lupus erythematosus. Certain medications can cause idiosyncratic neutropenia. The left shift is a critical clinical concept. It is when the bone marrow releases immature neutrophil forms into the blood in response to high demand. Seeing these young cells on the differential is termed as left shift and is a hallmark for acute intense inflammation or infection. The next on the list is lymphocytes. Lymphocytes are crucial for adaptive or specific immunity. Lymphocytes are responsible for highly targeted antigen-specific responses and immunological memory. They include B cells, T cells, and natural killer cells. T lymphocytes or T cells are responsible for cell-mediated immunity. B lymphocytes or B cells are responsible for humoral immunity by differentiating into plasma cells that produce antibodies. They provide long-term immunity by remembering past infections. Natural killer cells are part of the innate system that can recognize and kill virally infected cells and tumor cells without prior sensitization. Lymphocytosis or high lymphocyte count may suggest acute viral infections like infectious mononucleosis or Epstein-Barr virus, cytomegalovirus, hepatitis, or HIV. Certain bacterial infections like pertussis, chronic lymphocytic leukemia, and lymphoma. Postsplenectomy. Lymphopenia or lymphocytopenia, that is low lymphocyte count, may indicate acute stress, immunodeficiency syndromes like HIV/AIDS, severe combined immunodeficiency, autoimmune disorders like systemic lupus erythematosus and rheumatoid arthritis, iatrogenic causes like immunosuppressive therapy, chemotherapy, and radiation, protein-losing conditions like severe malnutrition and enteropathies. The next on the list is monocytes. Monocytes become macrophages when they enter tissues. They are involved in phagocytosis, antigen presentation, and cytokine production. Monocytes are the circulatory precursors to tissue macrophages and dendritic cells. They phagocytose debris, dead cells, and pathogens, and they process antigens to present them to lymphocytes, bridging innate and adaptive immunity. Monocytosis or high monocyte count may indicate chronic infections like tuberculosis, syphilis, amongst others. Inflammatory or autoimmune disorders like sarcoidosis, inflammatory bowel disease, and systemic lupus erythematosus. Malignancies like leukemia and lymphomas. Monocytopenia, that is low monocyte count. This is less common and rarely assessed in routine practice. It can be seen in severe sepsis, aplastic anemia, and during chemotherapy. Eosinophils. Eosinophils are involved in allergic reactions and defense against parasites. Eosinophils release histamines and other chemicals that modulate inflammation. They also play a key role in the pathophysiology of allergic diseases like asthma. Eosinophilia or high eosinophil count may suggest parasitic infestations like helminthic or other worm infestation, allergic disorders like asthma, allergic rhinitis, atopic dermatitis, amongst others, certain autoimmune diseases like Churg-Strauss syndrome, malignancies like Hodgkin's lymphoma, some non-Hodgkin lymphoma, and eosinophilic leukemia. Eosinopenia or low eosinophil count is difficult to detect due to normally low levels. It can occur with acute stress or corticosteroid use, which transiently sequesters eosinophils in the marrow. Basophils. They are responsible for allergic and inflammatory responses. Basophils play a role in allergic reaction by releasing histamine and other inflammatory mediators. Basophils, along with tissue mast cells, release histamine, heparin, and other mediators that cause the symptoms of immediate hypersensitivity reactions. They also play a role in defense against parasites. Basophilia or high basophil count may indicate myeloproliferative neoplasms, as found in chronic myeloid leukemia and polycythemia vera, hypersensitivity reactions, chronic inflammatory conditions like rheumatoid arthritis and ulcerative colitis, hypothyroidism. Basopenia or low basophil count is not clinically significant due to their low numbers and is not routinely reported. It can occur due to acute allergic reactions, hyperthyroidism, or prolonged corticosteroid use. A physician never interprets a white blood cell count differential in isolation. It is always correlated with the patient's clinical picture. Other complete blood count parameters like the red blood cells and platelet counts, the absolute counts, the presence of immature cells like the left shift, morphological abnormalities. By analyzing the proportions of the various white blood cells, healthcare providers can detect infections, inflammatory conditions, hematological malignancies, and immune disorders. Understanding these differentials allows for accurate diagnosis and timely intervention, which ultimately improves the patient outcomes. Thank you.